Mark our second holiday season of the pandemic. We're fortunate that this year's Thanksgiving looked different from last year's Thanksgiving. Thanks to remarkable COVID-19 vaccines and the millions of North Carolinians who got them, families and friends were able to gather more safely this year, sharing hugs and good food. Thanksgiving this year did feel more normal, but we're all painfully aware that we haven't fully defeated this pandemic. The Delta variant is still with us, causing sickness and death, mostly among the unvaccinated, while health alerts about the emerging Omicron variant have caused concern and opened a new set of questions. As the scientists and public health experts race to get answers about the new variant, we still know this to be 100% true. Getting more people vaccinated is the way out of this pandemic. If you haven't been vaccinated and you're worried about the Omicron variant, get your shot today. If you want to make your Christmas gatherings safer, get your shot today. These vaccines are safe, effective, and they're free. And they're saving lives every minute of every day by preventing people from getting severe COVID symptoms that could land them in the ICU or worse. And if you don't believe it, get off the internet and on the phone with your doctor. If you were vaccinated at least 6 months ago or 2 months ago for the J&J vaccine, go get your booster because it will strengthen your immunity. Make your appointment for that booster today. North Carolina is working hard to increase the number of vaccinated people in our state, including children who are now eligible. Just as we've done with the adult vaccine effort, we're working with trusted messengers, including community leaders, family doctors, and others, to have an open conversation with parents who have questions. And it's working. In North Carolina, we're up to 13% of children ages 5 through 11 who've received their first dose during the 4 weeks that we've been giving them. Since my executive order went into effect requiring state employees working in cabinet agencies to be vaccinated or tested weekly, the vaccination rate has increased from 65% in mid-September to 76% by the end of November. Our state health facilities have required vaccinations for their workers to protect them and their patients. More than 99% of those workers are now vaccinated. These numbers are good, and we're working to do more. And I appreciate all the private sector businesses that have similar rules for their workers and customers because you're making the right call to keep people safe. Before Thanksgiving, I signed a new bipartisan state budget that'll help our state out of this pandemic and come out even stronger on the other side. It includes hundreds of millions of dollars for business recovery grants, as well as funds for individual families that are struggling. It sends badly needed resources to local health departments who are on the front lines of the pandemic. It invests in our research universities where scientists are on the front lines of developing new treatments for COVID-19. And it funds filling the gaps in high-speed internet that have been magnified over the last 2 years. My administration is working hard to implement these solutions, and I look forward to the efficient and effective use of these dollars that'll speed us through this pandemic and do so much more. Now I'd like to ask Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, to provide an update on our state's COVID-19 trends. Dr. Cohen?
Thank you, Governor. Before we dig into the data, I want to take a minute to talk about the new COVID-19 variant that has been making headlines. All viruses change over time, and COVID-19 is no exception. The latest variant, Omicron, was recently designated as a variant of concern by the World Health Organization, and we still have a lot to learn about Omicron. Over the next few weeks, scientists will be looking for answers to several questions. Is this new variant more contagious? Does it make people sicker? And how will it impact our immunity and our treatments? Cases with the Omicron variant have not yet been detected here in North Carolina or elsewhere in the United States, but many experts believe it is likely already here. Now, while there's no need for alarm, we do need to continue to closely monitor the science and data on this new variant. And with that, we'll dive into the data. This first graph looks at people who come into the emergency department with COVID-like symptoms. It's our earliest detection mechanism. And the yellow line represents this current year that shows that this trend has come down significantly from its recent peak in early September. But you can see the yellow line has started to just increase slightly over the past few weeks. However, it does remain below where we were a year ago, which is shown with that blue line. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March of 2020. And you can see our first major peak in cases was back in January of 2021, before vaccines were widely available. That second peak in August and September was a result of the Delta variant and had the greatest impact on people who were not vaccinated. But let's zoom in and look at the last few weeks of cases. On this graph, we're looking at cases from October through today, and what you can see is that our cases have been largely level and appear to even have decreased over the past week. Now, we've made incredible progress as millions of North Carolinians have gotten vaccinated to protect their health and that of their community. But two things to note as we look at this graph. First, testing over the Thanksgiving holiday dropped significantly. So while case numbers are lower, this is probably an incomplete picture of what's happening in our state given the low amount of testing last week. Second, we won't know for a couple of weeks if Thanksgiving gatherings with unvaccinated people will have an impact on our numbers. Next, we'll look at the percent of tests that are positive, and this graph also goes back to October. Looking at that yellow line, our percent of positive tests has increased over the past week and is above our 5% goal. On our next graph, we look at day-over-day hospitalizations, and this graph also starts in October. And looking at that yellow line, you can see that trend has leveled. The next slide looks at what's happening at the local level. This is a map from the CDC that shows the level of viral transmission. I am pleased to report that North Carolina is no longer in the red zone as a state. The CDC has our state in the orange with a substantial level of community transmission, and several North Carolina counties are now yellow with a moderate level of community transmission. And you can see, looking at the map, the western part of the state currently has the highest rates of transmission. Now, let's look at vaccinations. Today, 72% of those 18 and older have had at least one dose, and 94% of those 65 and older are having at least one dose, and that's really good progress. Next, this slide shows the percent of the population that's received at least one dose by age group. You can see many families are choosing to vaccinate their younger children now that we have a safe and effective vaccine. Getting children vaccinated helps keep them healthy and protected from COVID-19. It's why I got my daughters vaccinated right away. You can see in the graph, fewer young people are getting vaccinated. And this is concerning because, as we saw during the Delta surge, it was really hard to predict who's going to become seriously ill from COVID-19 or who's going to experience those long-term symptoms from COVID-19. What we do know is getting vaccinated reduces your chance of getting COVID-19 and provides significant protection from serious illness, hospitalization, and death. Unvaccinated North Carolinians are 6 times more likely to get COVID-19 and 25 times more likely to die of COVID-19 than vaccinated North Carolinians. If you haven't gotten vaccinated yet, please talk with your doctor, nurse, or other medical professional, or go to a reliable online health resource like the CDC or yourspot.yourshot.nc.gov to be sure you're getting accurate information. Don't wait to vaccinate. And like many vaccinations, boosters are needed to strengthen and extend protection against COVID-19. Everyone 18 and older should get a booster as soon as they are eligible. If you got the Johnson & Johnson vaccine, you should get a booster at 2 months after your shot. If you've gotten the Moderna or the Pfizer vaccine, you should get a booster 6 months after your shot. With the holidays, colder weather, and this potential of a new variant approaching, you should not put off getting your booster. Now, before I wrap up, I want to take a moment to thank Governor Cooper. As the governor shared in a press release earlier today, I will be stepping down from my role as Secretary of the Department of Health and Human Services. I want to thank you, Governor, for your steadfast leadership, your partnership, and your commitment to the people of North Carolina. You're a man of integrity, faith, and resilience, and I have not met anyone who loves the state more than you. I've learned so much from you, and I'm so grateful for the opportunity you gave me to lead the Department of Health and Human Services. I also want to thank my incredible team at the department. I am so proud of our extraordinary work and what we have accomplished together to improve the health and well-being of the state. I'm forever grateful for your sacrifice and hard work. And while it's hard to step away, it's the right time for me personally and the right time for our team. The Department of Health and Human Services is in a strong position to continue to carry out its mission, and in choosing Chief Deputy Secretary Cody Kinsley as the department's next secretary, the governor has chosen an incredible leader to take the baton to run the next leg of this race. It has been an honor of a lifetime to serve this state at such an important moment in history. Thank you, Governor.
Thank you, Dr. Cohen. North Carolina has benefited greatly from your leadership over the past 5 years. And that's been especially true over the course of this pandemic, during which your work has saved countless lives. I deeply appreciate your service and your steady hand in times of crisis. You and I, along with our remarkable team, have been in the trenches together, and we're going to miss you. And speaking of a remarkable team, a leader you recruited into that group is ready to take the position of secretary when you step down, and he'll continue your legacy of strong leadership, Dr. Cohen. Cody Kinsley currently serves as your Chief Deputy Secretary at the department and has been leading COVID operations for the state. I'll appoint him as secretary immediately upon your departure. He'll continue to be supported by the team of doctors and public health experts who've advised and assisted both of us. Dr. Cohen, North Carolinians owe you a deep debt of gratitude. You have been such a blessing to our state. Thank you, my friend. But you have another month to go, and I know, as usual, you're going to be at it as determined as ever until the last day. So we're looking forward to the next month. Also with me today is North Carolina Director of Emergency Management, Will Ray. Our sign language interpreters are Monica McGee. And behind the scenes, Jackie Mativier and Margaret Wolf Roberts are Spanish language interpreters. So now we will take questions from the media who are here. We also have Secretary of Public Safety Eddie Buffalo here as well. Questions? You guys are slow on the draw today.
Governor Sean Cudahy from CBS 17. I think probably a lot of parents are nervous hearing the news of the new variant. What is your level of confidence at this point, based on what you know that their kids are going to be able to stay in school in person this year?
So my level of confidence is strong that vaccinations are going to continue to be the way out of this pandemic. We don't anticipate any additional restrictions at this point, but we know that there are questions to answer, and I'm going to let Dr. Cohen talk just a minute about the variant and her discussions with experts.
Thanks for the question. I think it's really important, as the governor said, for everyone to get vaccinated, and particularly now that our 5 to 11-year-olds can get vaccinated, I think it's really important to take advantage of this time. We haven't seen the new variant here in North Carolina nor in the United States, but we believe it is likely already here, so the time to act is now for vaccinations. I think we have a lot to learn about how this virus and its new changes may impact things going forward, but what we know is providing yourself that initial level of immunity through vaccination is going to be helpful. I think we are all concerned looking at some of the early data from other countries, seeing that it potentially could be more contagious. It doesn't, in early data, look like it is more severe, so that is good news, but it does show significant mutations or changes at the spot in the virus that we anchored our vaccines to. So again, things we want to really start to look at with our scientists, so we'll be watching that data very closely.
Governor, Jonah Kaplan with ABC 11. Before I get to Dr. Cohen, let's talk about her successor that you're nominating. And I say this is someone that she obviously has a lot of confidence in, you have a lot of confidence in. This is a role that has always been important, but it's become more visible to people. And we're still in this pandemic, and incoming Secretary Kinsler, he may have an extensive background. I saw the Treasury and as an administrator. He's not a physician, so what confidence do you have in him? And Dr. Cohen, for you as well, what can you say to North Carolinians who may say, well, he's not a doctor, how can he lead us in the pandemic?
Well, first, I'm appointing Cody Kinsley because he is the most qualified and experienced person for the job. He has been a part of this team for the past number of years, and we've seen him in action, and Dr. Cohen has put a lot of trust in him. Dr. Cohen and I, and Cody, when he becomes secretary, have been supported by a team of doctors and medical advisors and health experts who have collectively helped to advise us. So I feel very positive about Cody's leadership. I think this team is going to continue to stay together, and Dr. Cohen deserves an amazing amount of credit for recruiting some of the best people around to be a part of this team, and I have every confidence that he'll do a great job and the team will support him. You want Dr. Cohen to respond to that?
If she'd like to.
The only thing I would add, Jonah, is that this response, yes, is about making sure we can understand the science and data, and we have plenty of public health experts and doctors that the team will continue to support that. But so much of it is about the execution and the operations, and this is where Cody Kinsley really shines, and I have leaned on him so much to lead our operations. So I think him stepping into that role is really quite a natural fit. He has been leading so much of our work. I'm so proud of what we've been able to do when we rolled out the initial vaccine effort, and we were able to really charge that into high gear. That was his work, and so I think he really has his hand in the operations, which is what really matters to people. Are we going to get tests? Are we going to get our vaccines? Are the boosters out there? And then he will be supported by those public health experts at our department that are fantastic and have been advising me throughout this as well. Thank you.
Dr. Cohen, while you're still at the podium and while I can still ask questions of you, was there a moment, what you said this is the right time for you personally, was there something that happened recently? Is there a turning point in the pandemic? Why step away now?
Well, it's been a wonderful 5 years. I am so honored that I had this opportunity to lead the state at this moment. I think we've accomplished so much beyond, I know folks see the COVID response, but I'm really proud of the work we did the 3 years, even leading up to COVID. I think it made a difference in how we were able to be successful in responding, whether it was transitioning our